self-funded and group gap webinar today. For those of you who I have not met or spoken to, my name is Christy Saul, and I am one of the Vice Presidents of Marketing for URL's Health Option Division here at URL. And for those of you unfamiliar with URL, just a little bit of background on us. We are a family-owned, full-service brokerage firm offering all lines but property and casualty. And we have been in business now for over 26 years. We are located in Harrisburg, Pennsylvania, and for those of you who don't know where Harrisburg is, we are the capital. Little history lesson before you learn the products today. And we're right in between Pittsburgh and Philadelphia. That being said, although we are in Pennsylvania, we are nationwide. So we do have agents and agencies in all the states. We have very distinct divisions here at URL, which include individual health, group health, senior care products, annuities, life insurance, and ancillary products, which I kind of spearhead. The ancillary products would be disability, critical illness, accident and gap plans, group worksite, true group products as well. And we do have case managers in each of our departments here that help you work smarter and not harder. And they do this by following your cases from submit to issue. The case manager will run pre-screens for you. They'll run the quotes, and they will keep you posted 3 times a week on case status. And if there's any reason that your application would be declined, now in health insurance, that's not the case anymore. But for life carrier or something like that, they will also shop that case for you, so you don't have to go yourself to each carrier and see if your client would be acceptable. We also pride ourselves, and again, in diverse product portfolios and helping agents learn how to cross-sell in our different departments. So we actually have quite a few agents who write all lines. They write their health, life, annuities, and and cross-sell. With the changing times in healthcare and the healthcare arena due to Obamacare and commissions being cut, now is really, I think, the time to diversify or die if you haven't done so already. And if you've not written anything with URL, I really urge you to give us a try. Try us on for size and let us earn your business. So again, if you haven't worked with us and you're shopping a life case or an annuity or a health case, please contact us. And for those of you who are local, and again, you may not know that URL has a suite at the Giant Center for the sole purpose of having our agents attend hockey games or concert events. And again, if you are local and you haven't been to one and you'd like to, please contact me. In addition, all of your business through URL, be it life, health, or annuities, all has a point value, and they go to our annual convention. I just want to show you our website very quick before I hand the presentation over to Susan Schulman, who is going to be going over the concept of self-funding for groups, and Patrick Scott will be following her with Companion Life going over the group gap. And Susan and I were just talking before we got on, we started the presentation about, we all know what's going to happen in 2015, with groups and renewal rates, and, we're seeing it now. And this concept is going to be huge. And again, if you're not jumping on board with self-funding, another agent's going to come along and do just that, because every agent out there, there's only so many carriers. The rates are always going to be the same. So you'll just be presenting the same thing over and over again. And again, this is a huge, huge concept. I'm in love with the idea. And I'm not just saying that because Susan's on the phone, but it is. It's really kind of revolutionary. I think it's the way of the future. So this is our website. Oh, and by the way, I always forget to say that everybody is muted just because we have so many on the call, but there is an area to your bottom right where you can type in a question. You have a, hello? I thought I heard somebody, I'm sorry, background noise. But you can type in a question at the end of the presentation. We will go over all the questions and answers so you have that answered for you. And this is our website. It is urlinsurancegroup.com. And again, this shows all of our different divisions here at URL. I talked to some agents, and they said, I didn't know you did life insurance. I didn't know you do health insurance. Who we are, and this is our staff. So you know who to contact. If you are interested in annuities, you would contact Joe or Maria or Tony. It's our health. So it gives you contact information for everybody. Again, I'm not going to go into a tutorial on our website, but there's a lot of information here. This is our life department. There's forms you can access 24/7, lead programs, marketing tools. There's a lot of information on our website, and so I encourage you to check that out. Again, upcoming events will show all of our training. So there you have it. And again, I'm not going to steal the thunder from everybody else. So I am going to switch the presenter over to Susan Schulman, and she will take it from here.
Hi there, everyone. This is Susan Schulman.
Susan, make sure you click that little, I made you the presenter, and you have to, there you go. Perfect.
Okay.
Thank you.
Okay. My name is Susan Schulman, and I'm speaking to you from sunny South Florida, 75 degrees. Just so that you might feel bad if you're up there in the cold, I do feel bad for you, honestly. I'm a Florida girl. As you all know, we have had some very serious changes in healthcare as we used to see it, and it's here, and it's happening this year. I'm going to talk to you about changes in the way that we have always sold medical insurances here, and agents wanting to survive the transition need to open their eyes to new opportunities. I'm a strong believer that when change comes along, so does opportunity. And unfortunately, I speak to agents every day who think that they're out of a job, that they're never going to be able to make a living anymore. But if you're one of those agents who wants to explore the benefits of self-funded plans, and I like to call them smart funded plans, because they're called self-funded, but they're not, and I'll explain that as we go along. Self-funded plans sold with gap insurance plans. This is what our focus is. Why is self-funded an opportunity? Number one, it's not required by reform law to use community rating. And because we don't have to use community rating, we can pick and choose the groups that we're interested in and decline the groups that we're not interested in. We do underwrite the groups. So the type of groups that would qualify for self-funding are basically younger groups, although sometimes we have an older group, and they're very healthy people. But typically it's the younger groups when the average age of the group will tend to be under 45. And of course, healthier groups, groups with 15 or more participating employees. When we talk about healthier groups, oftentimes an agent will say, well, what are the requirements? What can we write and what can we not write? And the only way that I can answer that is that it all depends on the size of the group, the number of employees, how much premium is generated, so that they can look at that and know what type of risk they can take. For example, if we're doing a small group of 15 people and someone's got leukemia and they're going through chemotherapy right now, we're not going to take that account. But if we had 200 or 300 people, then it's a completely different story. So one of the most important things that you as an agent can think about when you're considering a group for self-funded is to talk to the employer and find out what type of risk we may have moving forward. If it's a smaller group, most of the time an employer knows who's sick, who's got serious problems. Larger groups, the HR person is usually aware of what's going on. So that's a very, very important question to delve into before you even start to ask for the census and tell them about self-funding, because if it's not going to work, it's not going to work. In most cases, our rates with self-funded will be less expensive than traditional insurance. When I look at rates with traditional plans, and I'm going to use Pennsylvania as an example because most of you, I guess, are up in Pennsylvania, I'm seeing rates with Blue Cross and Blue Shield literally tripling. And that's kind of scary. It's not quite as bad here in South Florida because our rates were higher than yours to begin with. So, our rates may go up 50%. That's a lot because our rates to start with are $500 a month. So let's explore the advantages. Here's a map that shows what was anticipated as far as rate increases with Obamacare. And you can see Pennsylvania is showing a 28%. I'm seeing way more than that on not all cases, but most cases that agents are sending us. In Florida, it's 27%. But like I said, the 27% is off of rates that were way higher than Pennsylvania to begin with. And you can see some of the other states, you know, like California, 62%. New York actually went down, which is not surprising, but it is surprising if you get what I'm saying, because their rates are probably the highest in the country to begin with. So I'm going to move on forward. A model for health in an era of reform. This is a model for a self-funded plan, and I'm going to go through this. Number one, that we sell and we propose only PPO plans only. All of our plans are PPOs. We don't do any HMOs or anything like that. We use a national PPO provider network. And in most cases, not all, but most cases, we're either using the Aetna National PPO Provider Network or the Cigna Network. Some of our plans, you have your choice, and some, you know, it's just one or the other. I mentioned self-funding, and I'm going to change that term a little bit, and I'm going to talk about smart funding, because self-funding kind of implies to people that the employer is paying, you know, everything out of his pocket, and he could get really nailed with some really serious stuff. Smart funding for what we're doing is probably a better way of showing an innovative, low-cost approach to financing health care for employer groups. And it's an affordable option that provides the financial protection of traditional health plans, plus the potential to save significant claim dollars. When you sell traditional insurance, you get a rate, $400 a month, $300, whatever it is for an employee, and of course for dependents. We show a composite of three different, what I call buckets of money. And the first bucket of money is the administration fees, which covers the cost of the TPA, administering the plan, doing the underwriting, paying claims. Agent commissions are in that bucket of money, et cetera, because we do like to get paid. The second bucket of money is the stop-loss insurance, and we'll talk a little bit more about that. Every self-funded plan is covered by stop-loss insurance for both specific and aggregate amounts. And as I said, I'm going to go into that later, so that any loss that goes over a certain amount of money, we have purchased stop-loss insurance to pay those claims. The third bucket of money is a bucket of money, and that's to pay claims. And that's the cost of the claim underneath what the stop-loss insurance provides, and after the deductible on the for the insurance plan. Now today, most of our deductibles are really $5,000 because the total out-of-pocket is $6,350. So somewhere between $5,000 and $6,350 is the point at which the smart funding or the plan starts to take effect. And if you think about it, if you have a group that's fairly young and fairly healthy, how many of those people ever go over $5,000 of claims a year? Very, 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 very few. And I say that for a reason, because that bucket of money that I just mentioned, at the end of the year, whatever is in there and is left after paying the claims goes back to the employer. If you had a Blue Cross Blue Shield and you know, at the end of the year, nobody had made a single claim, how much money would the employer get back? Well, we all know the answer to that. It's zero. Okay, number 4 here, no plan setup fees or runoff costs, and COBRA administration is included in the cost. When we give you the cost of the plan, if we say the employee cost is $120 a month or $180 a month or $200 a month, that's the maximum that the employer is ever going to pay. And that's like etched in stone. So that's why I hate to use the word self-funded, because it does imply otherwise. But this is like a fully funded, self-funded plan, often called smart funding in my office. And one other thing that we've added into the Healthy Choices product, which is probably our top-selling self-funded program or smart-funded program, is a 24 access to board-certified licensed doctors. It's a telemedicine plan, and it provides members with being able to call a physician, board-certified physician, on the phone, or do it by Skype or video 24/7 from anywhere. So if you're away on vacation and you left your high blood pressure medication at home, you can use this plan. There's no charge for using this plan. And the doctors are awesome. I used it for my little grandson when he had an ear infection one Saturday night, rather than trying to call the pediatrician and get told to go to an urgent care center. And within 12 minutes, they called back. They spoke to my daughter. They called in a prescription to Walgreens, and within an hour, the baby had the medication. I just think it's one of the coolest things that has come on the market recently. So that's included with all the quotes. Oops, wrong way, sorry. This just shows you a kind of a graph of fully insured versus self-funded, and it talks about 100% non-refundable premium, which is what I was talking about a minute ago. And then you look at the self-funded, and you have and that's composed of the stop-loss premium, the PPO, rental fees, the third party, the TPA, pharmacy benefit management, population management, integrated software, broker commission, program expense, those being all the fixed costs. And then you have your expected claims and then your aggregate corridor, which is the third bucket that I mentioned to you, being the claims bucket. Self-funding simplified. Employers pay, excuse that bad spelling, a fixed monthly amount that covers medical and RX claims, expected and aggregate corridor stop-loss insurance premiums, plan administrative expenses, and access to national and regional networks. Over the plan year, the TPA pays claims out of an account set up for the plan, and at the end of the runoff period, all unused funds are the plan's to keep. Unlike other traditional health plans, employers pay only for the health care their group consumes. Specific and aggregate stop-loss insurance, the specific, in case you don't know, it protects the employer if medical claims for any individual member exceed a certain threshold, the specific deductible. Claims beyond the specific deductible are covered by the specific stop-loss insurance. And then the aggregate stop-loss protects the employer if the claims for the entire group exceed a certain threshold. The aggregate attachment points, claims beyond the attachment point are covered by the aggregate stop-loss insurance policy. So that's kind of simplified, how that takes place and how it's handled. And this ensures, again, the employer will not have to pay more than the monthly fixed amount. I'm going to stop here with the slides, and I'm just going to talk to you because with 2014, we've had a lot of changes, and the slides for the new products haven't been revised yet. Basically, when I quote a self-funded plan, I use two specific products, and I couple them with gap insurance, which you're going to hear more about. I use the cheapest plans, or I shouldn't call them cheap, but the least expensive plans that we can come up with, and use the gap insurance to buy or to pay for all the claims from the very first dollar up to the deductible. The first plan that I use is the lesser expensive of the two, and that's a consumer-driven healthcare plan, kind of like an HSA product. And it has and you might want to jot these figures down because you're not going to see them on screen. Plan 1 includes a $5,000 annual deductible. It has no doctor copays. It has an unlimited lifetime maximum, and after the $5,000, it pays 100% of everything. With that plan, we come up with the least expensive cost, and I just did one for a large group, and the rate came in at under $200 a month for that plan. I think it was about $180. Now, you may say, well, my clients aren't going to buy that. You know, no doctor copays, none of that. Well, you haven't heard the other side of that, which is our gap insurance. There's good gap insurance, there's bad gap insurance, and there's some companies that claim to have a gap plan that really isn't a gap plan. A true gap plan, number 1, is guaranteed issue. Pre-X is covered right away. It's a group product with composite rating, and it covers inpatient and outpatient, and it pays what the deductible does not pay. So it doesn't just, you know, have a schedule that says we're going to pay $100 a day when you go into a hospital. The way our gap plans work, let's look at the hospital benefit first. If you have a $5,000 deductible, like you have with this plan, we're going to pay from the very first dollar, we're going to pay the full $5,000 if anyone goes into the hospital. For the outpatient benefit, we're going to pay up to 70% of the inpatient. So for outpatient, we're going to cover $3,500. So the maximum exposure to an employee or a dependent is $1,500 for outpatient. And if you really think about that, when you're using, you know, managed care rates, very few people are going to go over 3,500 outpatient before they go into a hospital. We've also just added this year physician office visits. So when I mentioned that the consumer-driven plan does not pay for doctor visits underneath the $5,000, the gap plan that you're going to hear about in a few minutes will pay up to $125 per visit. So that's brand new, and that's allowing us to show this inexpensive product because almost everything is going to be paid. And it's just an awesome, awesome gap program. The second plan that we quote, and sometimes we can bring in, we like to bring in two medical plans and have a starter plan and then a buy-up plan. And so I'm going to refer to the second plan as our buy-up plan. Although you don't have to use two plans, you could use one plan, but for all intents and purposes, it's going to be a buy-up plan. And it also has a $5,000 deductible, and then it pays 80/20 to $63.50. It does have doctor copays. It has a $20 copay for primary care, $40 for a specialist. It has $20 copays for diagnostic X-rays, lab services, etc. It's a Cadillac plan compared to the other product which I mentioned. And so you can sell either one or the other, or you can sell both, and the employees can pick and choose whatever plan they want. I'm going to go into a corporate presentation that I just finished for a group up in Pennsylvania. I had hoped to have it up on the screen, but I do not. So if you just want to jot down some of these figures, it'll help you to understand how I package both of the products together. The number one, the first part of the presentation is my goal. And I call this company Sunshine Corp. It's not the true name, but it's just, but it is an actual case. And our goal is to assist Sunshine Corp in selecting a health insurance plan that will, one, provide affordable health care, and two, provide benefits to the employees that will provide maximum benefits, keep out-of-pocket costs as low as possible associated with high deductibles and co-insurance and copay expenses. In this particular case, keeping the total premium as close to And keep this in mind, $300 per month per employee. It is to be noted that currently Sunshine Corp has a management carve-out, and they're not covering all 250 of their employees. They're only covering about 40 of them. It's written, of course, with Blue Cross. It has a $500 deductible and pays 100%. After that, with a couple of the little co-pays for doctor visits and emergency room. But basically, it's a 100% plan after a $500 deductible. The current monthly cost for the employee is $481 a month. You might want to jot that down because you're going to be really surprised when I talk to you about the figures that we're going to convert that to. To offer a low-cost plan, the consumer-driven health plan, option 1, we're offering, and we're taking into consideration all the employees because the employer has made that decision. He's no longer going to have a management carve-out. He's going to offer insurance to everyone. So we're going to use the number 1 option that I mentioned a few minutes ago. And the gap coverage is, excuse me one second. The gap coverage is going to pay $5,000 and $3,500, including doctor visits, up to $125. When we quoted the smart funding with the Aetna PPO network, the employee rates, now remember, before we were looking at $481, the employee rates came in at $161.89. This is a fairly young group, especially when we moved from management carve-out and we're taking the rest of the employees in. Most of them were in their 20s and 30s. So we dropped the cost to $161 a month. The gap insurance is $70 a month. So the total is $232 a month per employee. Now remember I mentioned to you that we were going to that our goal was to keep the rate under $300 a month. We very well have done that. We're offering a buy-up plan for those people that want to choose that and pay for the difference out of pocket. The employee rate for the buy-up plan is $213. The gap insurance is the same. It's $70, and the total monthly cost is $284. So we're still under the $300 a month. Now the difference between traditional coverage and when we quote smart funding is that we don't really know at this point whether we have any health problems within this group. But the fact that there's 250 employees, we can afford to take some risk on this. So once we have underwritten this case, we still have plenty of room for them to, if they have to add additional premium to cover additional risk, to keep it under $300 a month. And to summarize that in review, it's to be noted that by blending medical coverage with gap insurance, what we are providing is first dollar coverage to the employees at an affordable cost. Offering a base plan with a buy-up will make sense because the difference in cost is significant. The only negative in the consumer-driven plan is the prescriptions are not covered until after the deductible. That's the only negative. There are many discount drug deals offered at Walgreens and elsewhere. Some are free, and others can be purchased for a few dollars a month. Other than that, almost everything else will be supported by the gap insurance. And it is to be noted, again, and as I just mentioned, that these rates are preliminary rates based on final enrollment. Self-funded plans are underwritten to determine risk. And with our goal at the cost of Sunrise Corporation's medical plan not to exceed $300 per month for each employee, we feel there is enough allowance in the rates above to most likely meet this goal. And certainly the fact that they were paying $480-some a month, we're definitely going to write this case. So I'm going to turn this back to Christy, and you're going to hear more about the gap insurance, and you'll have an opportunity to ask me questions after the gap discussion. Thank you.
Okay. All right, I'm going to hand this over to Patrick now. Make make him the presenter.
Okay, thank you, Christy. And just confirm with me that you are seeing my screen now.
Yes.
Okay, good. Good afternoon, everyone. My name is Patrick Scott. You may see the name Stephen Parrish on your screen. Stephen is actually our National Marketing Director, but he is out of town today, so I'm filling in for him. So I want to thank you for taking the time to learn about one of our fastest growing products on the market. It's called medical gap insurance, as Susan alluded to earlier. So hopefully this webinar will impress you enough to allow an in-person meeting at some point in the near future. This presentation is set up so that it can be used to explain the gap concept to employers as well. So let's get started. So this slide basically shows you what's been going on in the healthcare industry over the past 15 years. This is something you already know, but the premiums have been going up every year. Over the past 15 years, we have seen a 200% increase in the cost of insurance for a family of 4. So the question is, how do you respond to this problem? Well, there are 3 ways to respond. One, the first response is hopefully not anyone on this call. It's called the ostrich approach. The broker is lost with all the changes going on. He just sticks his or her head in the ground like an ostrich. The second approach is a little better than the first. However, it's not our goal. This is called the cost shifter. This person frantically moves deductibles and copays around just trying to find a way to lower the cost for the employer. But all this does is shift costs from the employer to the employees. This response does not really fix the problem at hand. So the third response is hopefully what all of you are, the Thomas Edison approach. A Thomas Edison is someone who thinks outside the box. This person uses different strategies to tackle their group's medical plan. Some examples of thinking outside the box are using HSA and HRA plans, self-funding, as Susan explained, worksite benefits, etc. The strategy that we're going to be talking about today is gap insurance. So the gap concept primarily combines the primary major med insurance along with the secondary gap insurance plan. Together, we create a lower cost health plan with incredible first dollar benefits. Utilizing both plans instead of one generally saves your clients around $1,000 per employee per year, plus enhances the benefit package at the same time. Some of you are probably thinking that this sounds a lot like Medicare supplements to fill in the gaps in primary Medicare coverage. Well, you're correct. We essentially are doing the same exact thing. We're filling the gaps in primary major medical in the form of deductibles and coinsurance. It's also important to note that seniors who are very familiar with the concept of having 2 plans instead of 1, they don't seem to mind it, and if they can do it, so can your clients. So how does it work? Each employee receives 2 ID cards. The first is their standard major medical card, and the second is a gap insurance card. They each give both these cards to the provider every time, and the provider has the ability to file the claim for them. It is very important to note that the employees can tell the provider that our plan is secondary insurance. That way, the provider knows that if they file our claim, they're going to get paid. We've seen in certain markets that gap insurance is a bit of a curse word, for lack of a better word, and secondary insurance works a lot well. So all that is needed now to process a claim is an EOB from the primary major medical carrier along with the itemized bill. Essentially, when the provider gets ready to send the bill to the insured, they send it straight to us instead, and that way we can pay it and get right back to them. So here is an example of one of our EOBs that we send to the employees after we have paid the claim. Look at the bottom left where it says charged amount $507. This was the total amount of the claim. Now look to the right a few columns to see where it says provider discount $176. This means that the claims were discounted at $176. The next column shows you the amount left over, $330. This is the amount normally billed to the employee, but if you look at the bottom right of the screen, you will see that we cut a check for $330 to the provider. So the employee does not have anything to pay out of pocket. This is reflected where it says amount you owe to the provider, which is, of course, $0. So this is the exciting part about our product. When was the last time you were able to give your clients a plan that essentially gives them a $0 deductible? Well, that's pretty much what this product does. Now you're probably asking what the actual benefits look like. Well, there are two quote-unquote buckets of money, inpatient and outpatient. On the inpatient side, we are able to allocate as much as $10,000 in a bucket of coverage. This coverage is intended for inpatient stays, inpatient surgery, in-hospital physician charges, and ER treatment if admitted to the hospital. From there, we also provide an outpatient bucket of money. This coverage is intended for services rendered in a doctor's office, hospital outpatient facility, outpatient surgical facility, or MRI/imaging facility. It's important to note that the outpatient benefit cannot exceed over 70% of the inpatient benefit. So let's paint the picture a little more clearly. This illustration helps explain the plan we built in the last slide. The concept is very simple. If we look at the column on the left, this is how a standard $1,500 deductible plan is set up. Employees are required to pay a $1,500 deductible before they receive any benefits. The majority of healthcare expenses fall in this first $1,500, which is frustrating to many employees. By adding a gap plan, we actually pay these covered expenses for the employee. So let's reemphasize this concept using this chart here. The column on the left shows the current plan, which requires the employee to pay $1,500 on the front end. And by the way, this is the column in the middle if you're looking at this slide. And the medical plan picks up the next $3,500 on the back end. The column on the far right shows how a gap plan pays the first $3,500 and requires the employee to pay $1,500 on the back end. So essentially, we're just flipping the out-of-pocket responsibility. It's important to note that we strongly believe that leaving employees with some out-of-pocket cost responsibility is a strong note. We want them to build responsibility with our clients. Our goal is just to leave this responsibility on the back end rather than the front end. So ultimately, we are just helping the employees manage their expenses, hence the Crescent Medical Bridge, asset protection. So let's look at an actual plan design to compare. Before we compare these plans, it's important to note that the average employee out-of-pocket expense is given in a year, per year is right at $2,000. Our first dollar gap plan is designed to significantly reduce this number for employees. On the left column, we have a standard $1,000 deductible 80/20 plan to a total out-of-pocket of $2,000. With this plan, x-rays, labs, therapy, durable medical equipment, inpatient services, outpatient services, MRI, CAT scans are all the same to a $1,000 deductible plus coinsurance. So the employees are out of pocket for pretty much everything besides the common cold. So let's look at the column on the right to see how our gap concept will handle these same expenses. We have now modified our plan to a $4,000 deductible, 70/30 coinsurance to a $6,350 total out of pocket. You may recognize this $6,350 as a typical metallic plan in your state. We have added a gap plan to work in harmony with our new medical plan and significantly lower the out-of-pocket exposure for the employees. For inpatient expenses, the gap plan will cover the entire out-of-pocket exposure. The employees will have 100% coverage for hospital expenses. For outpatient services, including x-rays, labs, surgery, you name it, the gap plan pays for the first $4,000, leaving the employees responsible for the remaining 30% coinsurance. Again, the concept is very simple. We're just giving employees coverage where they need it the most, which is up front. What is great is that the best is yet to come. Let's see how the premium compares to the current plan. This visual is pretty self-explanatory, but I'll briefly walk you through it. This particular group received a substantial rate increase on their current plan and was desperately searching for a solution. As you can see, the employee-only rate went from $411 to $458, and the total premium increased from $34,000 to over $38,000. So the new $4,000 deductible plan has an employee-only rate of only $309. We then implemented a gap plan with our employee-only rate of $94, which gives us a combined rate of $403.95. The total monthly premium with our new gap plan design was just under $33,000. So if we think back to the plan benefits that we discussed on the previous slide, we realized that we gave the employees better coverage and managed to save the employer over $5,000 a month versus their renewal plan. So using the gap plan design saved this employer over $60,000 annually versus their renewal rates. The employer was able to give his or her employees first dollar coverage and save substantial premium dollars. So take a second to let this soak in. Upfront savings while enhancing benefits is a key to our product. So as we kind of close here, we want to kind of give you our slogan right now, which is plutonium. We take the bronze, we add in the gap, and we have plutonium. So we know that every company's benefit plan is unique to the employees and their families. We believe that we can help the employers save a significant amount of premium without shifting large costs to the employees. The best way to see if it works is just to try. I would urge you to gather your current and renewal plans and look them over with 2 alternate plans with higher deductibles. Send them over with a census. We can see if a gap plan can work for you. I can assure you that they probably will. I want to thank you for taking the time out of your day to learn more about our plans, and we look forward to working with you. So with that, I will take it over to Christy and or Susan, and let me know if you have any questions. My email address, again, my name is Patrick Scott. My email address is pscott@resolutionre.com. That's PSCOTT@resolutionre.com. I work aside our National Marketing Director, Stephen Parrish. Stephen's email address is ssparrish, that's SSPARRISH, again, at resolutionre.com. Thanks.
Well, thank you, Patrick. I'm going to pull up and see if we have any questions. We do have some questions. First one is, can they be email copies of your presentation? And yes, I have a copy of the PowerPoint, and I can send that to whomever is interested in that. Couple of those questions. Do you have copies to the presentation? And Susan, do you have, I know we didn't get those slides up in time, but do you have those that I could send out to agents?
Yes, if you're interested in seeing the actual case study that I talked about, you can just call URL, speak to Christy, or if you want, my email is Susan Schulman, SHULLMAN, I'm sorry, take that back, Susan at mainstreetinsurancebrokers.com.
Yeah, or you can all contact me. You should all have my email address because you got the invitation for the webinar. But my extension here is 131, and for those of you who don't know the number to URL, it's 800-926-8875. My direct extension is 131. John Reel in my office also helps with the SMART funding. I'm going to start using that, Susan, the SMART funding plans and the Crescent Gap plans. And, if you can't get me, feel free to contact John as well. Let me get to some more of these questions. Is the product approved in California? Going to both, I would imagine, for the Gap and also the SMART funding.
Well, we have a number of self-funded products, and I couldn't tell you right off the top of my head which ones are available in California, but I can tell you that they are available in California. And I'm just going to ask Patrick to speak on the Gap product.
I'm sorry, Susan. Say that one more time.
I just wanted you to mention whether your product is approved in California.
Unfortunately, we are not approved in California. We're still fighting with Companion on that front.
Okay. And I'm assuming neither are approved in New Jersey, and I just say that because I know New Jersey's pretty much impossible. Is that correct?
Yeah, New Jersey is a pretty tough state for us too. We don't have any of our products approved there.
Right. Now, and Susan, correct me if I'm wrong, but I know that you don't have the self-funded products in New Jersey, but that being said, for example, if the group is domiciled in Pennsylvania and they have employees in New Jersey or, say, New York, they can be covered? Am I correct in saying that?
Yeah, I had a case just like that, and as long as the corporate headquarters is in Pennsylvania, that's how we determine whether we can write the case or not.
Yeah, Christy, that's the same for us too. We actually just wrote a case in the state of Colorado that There are multiple locations outside of there in New York, California, Washington State. Yes, as Susan said, as long as we're domiciled in an approved state, we're good to go.
Okay. And a question I do always get, and I always get it sometimes after the webinar, is I think some people get confused that the gap has to be sold with the self-funded and vice versa. I mean, if you have an existing group, you can sell the gap plan separately. They're not, I mean, they're great to be married to one another, but it doesn't have to be, you know, you have to have a self-funded plan in place and, you know, to get the gap. But if you have an existing group that has a higher deductible, we can run a quote for you as well. And Susan, do you want to, I mean, I know you've told John and I what you need for a quote, but do you want to tell everybody what they would need to get an accurate quote or what you like to see?
Yes, I will. What I like to see is, number one, that you have talked to the head of the company or HR and that you have confirmed that to the best of their knowledge, here are, you know, the risks and here are the health problems we're looking at. So that's going to help right up front. I need a census. I need to know the name of the company. If the name doesn't describe what the industry is, I need to know what they actually do. Or if you have the industry code, that's fine, and also the address where they're located. I also like to see, for purposes of doing a case study, I like to know what their existing plan is and what the rates are, and I like to see the renewal rates if you have them. So that's going to help us in determining, you know, how we're going to make this program look right. I had one case the other day that the rate only went up 15% on the Blue Cross plan, and it didn't even make sense to quote the self-funded. So as Christy has mentioned before, we're just going to do the gap plan only for that particular case to cover under the 6350.
Okay, next question. Do employees hired after the enrollment have to complete medical underwriting? And if so, could it affect the group's premium?
They would automatically come into the group and would come in at the same rate for their duration of the year. But when the year is up, it's definitely going to affect the renewal.
And one question was, who is the gap carrier? Well, it is companion. Next question is, do you offer a qualified HSA option? And do you integrate with a company like Health Equity?
A company like what?
Health Equity. And you offered a qualified HSA option.
Yes, we can offer an HSA option, absolutely.
Okay.
But I always will take a look at the gap insurance because I just think that's a cheap way. It's less costly than having to put money aside for, you know, in an HSA. Is just to use gap coverage, but that's my own personal opinion.
Okay. Somebody's asking about RX coverage on the plans.
It depends on which smart funding plan we use, but the prescription benefits are probably, I know if I'm comparing them with plans here in Florida, the prescription plans are better than anything that any of our carriers offer on the prescription plans. They're very, very comprehensive, and I can send those to you to look at.
Christy, our GAP program is currently going through a soft rollout with our RX riders. They are not fully developed yet, but they will be, I would expect, by the end of this first quarter. So more details on that to follow.
Okay.
Oh, wow.
All right. Susan's excited. Next question for Susan. What insurance carrier holds the gap risk, and what is the rating? I'm assuming AM Best rating or something like that.
It is Companion Life, and they are an A+ rated company.
Okay. For self-insured plans, do they get experience reports at the end of the year?
Absolutely. They get them every month. Every month they get statements so that they can see where they're, what's going on with their claims bucket and, what's in there, what was paid out, et cetera.
Next question for Susan is, did your cost example include runoff? I'm not sure.
I'm not sure what of that. There is a runoff on all plans. Typically, it's 6 months, which is long enough to process any claims that didn't come in by the end of the year. And so I guess the answer would be, that it is included in the cost.
Okay.
Or in the premium.
Next question. For self-insured, is there a participation requirement or a certain percentage of employees that must be covered within the group, to quote?
Yeah, some of our plans are 50% of eligibles and some are 75% of eligibles.
Okay. Can a business with independent contractors be covered?
No.
Didn't think so.
That's my shortest answer today.
Next question. Is there a form each employee must complete for setting rates? Can it be done in getting quotes?
That's a great question. We have pretty much 3 ways that it can be done. It can be done by paper app, which is the hardest, mainly because it's time-consuming and people always leave stuff off and then they kick back to us. We can also do it via the telephone, where they're all given a phone number to call in, and a representative will ask them the questions and complete everything on the phone. And of course, the other option is to do it on the computer, where we set up a website and they have a login and they go on and the screen, they fill out all the information, and if they skip something, it's going to bounce back. So once it's done, and nothing can be left off.
Okay. Let me see. There's more. Are the plans available in PA? Absolutely, they are available in PA. And I think you just cover the participation, but the self-funding will go down to 15, correct?
Yes.
Okay. And I know the carriers, but they're asking who are the carriers in Pennsylvania that we are using.
Well, we're using, our number 1 plan is Healthy Choices, which is actually based out of Tampa, Florida. And that it's just it's a great plan. It ties in with Mayo Clinic, in addition to everything else, where you can go online with Mayo and ask them any questions, anything that comes up. They just have a lot of little bells and whistles on the product, and they're very, very competitive in Pennsylvania. We also use Starmark. They're also very competitive. But the whole thing is blending these together, not just getting a quote. It's actually the blending that creates the sale and knowing how to put that together. So that's where my job comes in.
Okay. And somebody is asking for a product approval grid. I'm not sure if we have a grid, Susan or Patrick, but I'm certain you can both get me the states. It's probably easier to get me the states that the products are not approved in versus where they are. But
Christy, I can send you a list of who's not approved and who is approved.
Okay, perfect. Next question: are claims in excess of stop loss paid immediately, or must employer continue until year end?
I'm not understanding that question. Could you say that again?
Are claims Are claims in excess of, I just lost it. Oh. It just seemed to disappear. So I'll move on to the next one. And again, if I missed your question, please shoot me an email. Next one is my local TPAs are using online health forms for the 25 to 100 size groups. Are you offering that option?
Yeah, I just mentioned that.
Okay.
So we can do them online or on the telephone.
Hey, Christy, I have that last question. Sorry about that.
Okay.
Are
okay.
claims in excess of SL paid immediately, or must employer continue until year end?
I'm still not sure what they're asking. If they're asking if an employer can drop the coverage in the middle of the year, no, they're tied into a 12-month contract.
No, I think it was a question about claims in addition to the stop loss. But you know, if there's a stop loss, then I would imagine there. I don't know. I'll get clarification on that.
Hey, Christy.
Yes.
While you're still going over the rest of these questions, I'm going to go ahead and launch the poll for people that might want to be followed up with after this call. You can go ahead and answer the questions that'll just come up on their screen.
Okay. Next question is, will this work for a nonprofit organization?
As long as there's an employee-employer relationship, yes.
Okay. Next question or comment is, I was told you cannot use a GAP plan with an HSA. You either fund the HSA or you have the GAP, but you cannot have both.
Yes, Christy, IRS policy will not allow us to place a GAP with an HSA individual account.
Next question, and it doesn't indicate who the question's for, so maybe you can both answer it, but do you have Spanish-speaking reps for the self-funded call-in health line? Oh, it's for the self-funded.
Yes.
Do you know? Yes?
Yes.
And that would be you, correct?
Me?
I'm joking.
So. Just because I'm in South Florida doesn't mean I speak Spanish.
I'm joking. Okay, and I don't know the answer to this one. Will the self-funded carrier or GAP carrier accept employees who have individual tax identification numbers?
Accept employers?
Well, Christy, as long as their premium is being sponsored by the employer, we don't hold any sort of regard to individual tax IDs or anything.
Okay. Okay, and must the employer continue to fund claims in excess of stop loss, or does companion pay immediately?
Well, any claims in excess of the stop loss are going to be paid by the stop loss carrier first.
Okay.
And then if there's something that didn't get paid, then the GAP always pays second. It waits to see what the carrier is paying, and then it pays what's left.
All right. I think the last question we have, Susan, is which Aetna network do they use?
The National PPO Network.
Okay. I'm pretty sure I knew that too, but you're the expert online, so I don't want to answer the questions for you. I think that is it. And again, my email address is Christy. It's KRISTIS as in Sam at URLINSgroup.com. So shoot me any questions you have. Again, this is, we've done this webinar a few times. I've met with Susan, so I have a pretty good handle, on how the SMART or self-funding works, but again, I don't have the answers to everything, so if I don't have the answer to your question, I will go to either Patrick or to Susan. And thank you, Patrick and Susan, so much for being on the webinar today. It was a great presentation. I appreciate it.
Thanks, Christy.
And thank you, everyone.
All right. Thank you, everyone.
Christy, let me add one more thing before you sign off. This is Jim McDaniel here at URL. If anybody on the call still is interested and you haven't participated in the poll yet, and you would like us to follow up with you after this, please submit yes on there. If you don't want us to bother you and you're just here to kind of look around for today, please click no. We really only want to reach out to people that are truly interested, and we don't want to waste your time if you're not. So if you could submit that for us, we thank you again for attending, and we'll be in touch with everybody shortly.
Thank you, everyone.
Bye-bye.